Hi, everyone. I am Dr. Kylie Fuller, a board certified OB-GYN. And today I'm answering all things pregnancy, aka the most common questions I usually get asked. Pregnancy does come with a lot of questions. And if you are feeling overwhelmed, you are definitely not alone. So let's get started. One of the first questions I hear is, when should I meet you? When should I establish with an OB-GYN? This is a trick question. The answer is actually before you get pregnant, and it's called a preconception visit. No worries if you're already pregnant, we will make it work. But this visit allows us to review any medication you may be on, your past medical and surgical history, and discuss lab testing that could impact the health and timing of your future pregnancy. This visit allows us to optimize everything prior to the stresses of becoming pregnant. Another really common question is, what vitamin should I be taking? A prenatal vitamin is the correct answer, not a multivitamin. And you want one that includes folic acid, iron, choline, and DHA. Folic acid especially is important early in pregnancy because it helps prevent certain birth defects. And because it does this, it's important to also start this prior to becoming pregnant so you can build up your levels. Next question people ask is, what food should I avoid while I'm pregnant? It can feel like a long list, but in general, you'll want to stay away from raw or undercooked meats or fish, unpasteurized dairy products, and certain high mercury fish like shark, swordfish, and king mackerel. And if you're ever unsure about something, just ask. That's what we're here for. Exercise is another hot topic, and I get asked if it's safe to work out during pregnancy. For most low risk pregnancies, the answer is a resounding yes. Walking, running, swimming, yoga, Pilates, and light strength training are all usually safe. And if you were active with a routine before pregnancy, you can generally keep doing the same thing throughout pregnancy, maybe with a few minor adjustments as the pregnancy progresses. Remember, Olympic athletes get pregnant. Bed rest is out and healthy pregnancies are in. Another question I get a lot is, what symptoms are normal and when should I be concerned? Things like fatigue, breast tenderness, mild cramping, and light vaginal bleeding or spotting can actually be totally normal, especially in early pregnancy. Heavy bleeding, severe abdominal pain, or inability to tolerate liquids are not. And those should be checked out right away in the emergency room or labor and delivery. People also ask how often they'll get to come visit us for their prenatal visits. Typically, appointments are every 4 weeks early in pregnancy, every 2 weeks in the third trimester, and then weekly towards the end. This, however, can vary depending on the different medical conditions you may have during your pregnancy. And finally, what can I do right now to support a healthy pregnancy? It's easy. Focus on coming to see us for regular routine prenatal care, eating balanced meals, staying hydrated, getting rest when you can, and avoiding things like alcohol, smoking, and drugs. Every pregnancy is different, so personalized care really matters. If you're pregnant or planning to be, schedule a visit so we can talk you through your questions together. See you in the office.